This is part one of a series of video demonstrations of surgical incisions from the skin. We're starting with the marking out of the skin cancer and the anaesthesia. So the first part here is we need to have good lighting, some magnification, so that you can work out the exact margins of the lesions. And most times with stretching the skin, good lighting and magnification, you can work out the surgical margin. And so I tend to use dots to work out the margin first, and then effectively connect the dots, drawing out the circle. And my plan always here is that I'm going to cut outside of my blue texture mark. I then move the skin, as you saw there, to feel which direction the skin wants to close, to work out my direction of closure once I have the surgical margins. Now this is preferable to do the surgical markings in the natural position for the patient. This is often when they're sitting up, is a good idea of the directions. Once we've worked out our lines of closure, we then convert our drawing into an ellipse, and we're going to cut outside of this blue texture mark for our surgical excision. We then wipe down the skin around the blue texture marks. If we wipe the texture marks themselves, of course, that'll smudge the surgical margins, and then we're ready for our injections. So we're using some 1% xylocaine with adrenaline. Stretching the skin first before inserting the needle makes it less painful, and I tend to start at one tip and injecting quite superficially into the upper dermis and working my way around the edges, as we see here, gradually injecting small volumes of anaesthesia. So the total volume I'm using here is about 1 to 1.5 mils as we work our way around, a little bit centrally under the lesion as well. But you can see the slight blebbing of the skin as I'm injecting here, and this gives a fairly rapid anaesthesia.